Same time, so it's going to be Thursday at exactly 11 or 11:15. The link is already posted in your Google Classroom. So for those of you who have already tried yung ating trial exam kanina, so ganun yung ma-experience ninyo during the actual examination. So yung same application, i-allow ninyo for microphone and camera. You will promise that you will always keep the camera open and the screen sharing, yun, hindi nyo siya isa-stop. So kung ano yung na-experience nyo kanina sa trial exam, ganun po yung actual exam na mangyayari next week. Now, sa ating Google Classroom, naka-upload na po yung link. Hindi nyo lang siya mabubuksan for now because it will only be open next week, Thursday. Okay, at exactly 11 a.m. ata yung sinulat kong time. Okay, so when you go to Google Classroom, you can also see kung ano yung magiging coverage ng ating exam for next week. So from the very start nung January, so pakibalikan na yung mga naunang lessons na baka nalimutan na at naibaon na sa limot. So our first topic is the classical experiments on spontaneous generation. And then yung mga ginawa ninyong concept map, if you think it will be helpful for you in reviewing yung topic on the experiments on spontaneous generation, pwede nyo yung gamitin. At the same time, kasama sa ating exam yung unifying characteristics of life. Lahat yon. And then meron tayong tatlong organ systems na kasama for the exam, the digestive system, the circulatory system, and the respiratory system. Okay, so the book, the electronic copy or the digital copy of the book is uploaded in the Google Classroom. May mga learning and reading materials and videos that was uploaded in the old Google Classroom. You can still access them. Pwede nyo pa rin yung buksan at pwede nyo pa rin yung gamitin. At the same time, all of the recorded discussions or the recorded videos of our discussions from the very first experiments on the spontaneous generation hanggang sa respiratory system, it's all on YouTube. So if you think you need to watch or listen to the discussion again and again and again, kung helpful yun sa inyo, okay lang po, you can watch the video as often or as frequently as you need to help you prepare for the upcoming exams. Yung mga grade 12, usually yon before the quiz or before the exam, talagang yung recorded discussion namin umaabot ng 40, 50, 60 yung number of views kasi nga paulit-ulit nilang pinapanood. So you know yourself and you know kung ano yung strategy or way ninyo of learning and relearning concepts and ideas. Kung kayo ay kailangang gumawa ng reviewer at magsulat, kung kayo yung taong kailangan lang pakinggan ng paulit-ulit, kung kayo yung taong kailangan basahin ng paulit-ulit. So you do whatever is necessary to help you prepare for the upcoming exams. Okay, so that will be again, same time on Thursday at exactly 11 in the morning. So pagdating ng Thursday 11, punta na kayo sa Google Classroom and then click nyo na yung link doon sa exam para ma-redirect na kayo doon sa questions. Okay, do we have questions about our exams next week? Questions, concerns, things that you want to clarify before I start with a new lesson today? Taas lang ng kamay or paki-chat ang inyong mga tanong. Okay, so far wala namang nagre-raise ng hand. So if you have questions, message na lang, siguro later on after class, pa-personal message na lang ako or pa-forward ng inyong question doon sa inyong individual group chat or even sa Google Classroom, pwede kayong mag-post ng question doon. Okay? So our topic for today is all about the immune system. Now, the immune system is not going to be included sa exams ninyo next week. Okay? This will be included doon sa quiz ninyo siguro by mid-March. Ang kasama na doon ay yung circulatory, respiratory, tsaka immune system. Okay, so I'm going to start. Medyo bababawan ko lang yung discussion. So the immune system, ang function niya in our body, of course, is to protect us. And the body is able to protect us by creating or producing a certain response to diseases or injuries. Okay? So pagka merong disease na nakapasok, na pathogen na nakapasok sa loob ng katawan, or merong injury na nangyari sa inyong katawan, the body will create a certain response that will protect us na lumala yung sakit or lumala yung injury. So meron tayong mga tinatawag na responses. At yung response na yon is made possible, or yun yung pinaka-primary function of our immune system. Now, the response that our body produces in relation to this disease or this injury is classified into two. So meron tayong tinatawag na non-specific response at meron din tayong tinatawag na specific response. So yung non-specific response, ang nakasulat dito is that it is an innate immunity. So when we say innate immunity, ibig sabihin built-in yan sa katawan mo. When you were conceived and when you were born, meron na yan sa katawan mo. So ipinanganak ka na meron na itong first line of defense na naka-establish na sa katawan mo. So kahit anong sakit, automatic yon, bata ka man or fetus ka pa lang sa loob, nakakapag-create na ng certain non-specific response ang katawan mo. Other than that, we also have what we call as your specific response. So yung specific response kasi, it's already acquired immunity. So when we say acquired immunity, ibig sabihin, originally, wala ka niyan. Pero pwede mong dagdagan yung immunity ng katawan mo. So diyan papasok yung tinatawag nating vaccines or vaccination. And later on, we will talk about that a little bit more. Okay? So for now, what we are going to focus on is itong mga tinatawag nating non-specific response muna. And then from there, we're going to continue with the specific responses. Okay? So bakit nga ba kailangan ng katawan natin ng immune system? Is it possible for our body to maintain yung ating homeostasis in the absence of an immune system? The answer is actually no. Because kung meron tayong innate na immune system or innate na responses, meron din tayong tinatawag na mga pathogens. And some of these pathogens are, most of these pathogens are really naturally occurring. Talagang nandyan sila in our environment, nakatira talaga sila dyan sa balat mo. Kahit anong ligo mo, you cannot remove 100% yung mga pathogen na yan sa katawan mo. Kahit anong linis mo ng bahay, you cannot remove 100% yung mga pathogens na yan. Ano nga ba yung pathogens? So pathogens are organisms and usually they are microscopic. Maliliit talaga sila. And these organisms are very specific because they cause diseases or illnesses. So pag nakapasok siya sa loob ng katawan, that's when they will produce this negative effect of making you feel sick or nakaka-acquire ka na ng sakit or diseases. So ang pathogens, medyo malawak yan. Some of the pathogens are viruses, viral form. So for example, yung SARS-CoV-2 na virus, those are pathogens. Some pathogens are bacteria or bacterium. So for example, yung nagkukos ng Black Death or Ebola. No, Ebola is virus. Yung nagkukos ng Black Death is actually bacteria in nature. Yung mga ibang sakit na na-experience ninyo such as pneumonia and tuberculosis, all of those are caused by bacteria. Yung sipon is caused by a virus. And then some of them are fungal infections, some of them are parasites, and some of them are protozoans such as amoebas. So maraming iba't ibang uri ng organisms that are classified as pathogens. Pero yung similarity nila is that sila yung nagdudulot ng mga sakit. Not just sa tao, but in other living organisms such as yung mga animals and plants. So as long as they are causing diseases, they are categorized as pathogens. Okay? And other than your pathogens, there are also some environmental substances that can cause certain reactions in our body. So for example, yung poison ivy, halaman yan, at pag nadikit ka dyan, automatic yan, makate, namumula yung balat mo. So may nakuha siyang certain response sa katawan mo kasi ibig sabihin may chemicals in that, natural chemicals in that plant na hindi siya nag-okay sa balat mo pag dumikit siya, nag-flare up, parang allergy, ganon. And sometimes there are toxins in the materials that we are using, yung mga gamit na ginagamit natin sa loob ng bahay. And then of course, meron din tayong mga processes in our body na very natural, pero sometimes hindi siya nangyayari ng tama and they can cause abnormalities or abnormal cells such as what we call as cancer. Okay, so nagkakaroon ng mali dun sa dapat tamang nangyayaring processes. So lahat ng to, they are happening every day around us. So sabi ko nga, hindi nyo maaalis yung pathogens na yan. Di rin naman natin pwedeng alisin yung chemicals in the poison ivy that can produce these certain reactions. May mga gamit talaga na naturally may toxins. So kailangan natin ng immune system kasi the risk and the possibility of these pathogens and toxins entering our body or happening to us, napakataas. Any day, anytime, pwede tayong maka-acquire ng sakit. At ang unang response ng katawan natin is made possible because of the immune system. So bago mo pa inuman ng gamot, meron ng action na ginawa yung immune system mo para labanan yung sakit na yon. Okay? So very important ang ating immune system. This is our first line of defense against certain illnesses or diseases. Okay? So sabi niya dito, immunity kasi, the word immune system, syempre ang idea dyan is immunity. And immunity is the ability to resist infection and resist certain diseases sa iyong katawan. So pag mataas ang inyong immunity, pag very healthy ka at malakas ang katawan mo, malakas ang inyong immune system, malakas ang inyong immunity, hindi ka ganun kadaling tamaan ng sakit. So may mga tao talaga na naturally mas madali silang makapag-catch ng sipon or mas madali silang magkasakit, pero meron namang mga tao na kahit well-exposed na, ayan, hindi pa rin sila nagkakaroon ng sakit. Example, ngayon sa COVID, most of us naman were exposed to the virus. Pero bakit nga ba yung iba nagpa-positive? Yung iba naman asymptomatic. So ibig sabihin, hindi nila, naikakalat lang nila yung virus, pero sila, yung katawan nila mismo, hindi na-apektuhan or hindi sila nagsasuffer doon sa mga symptoms ng virus na yon. Tapos meron namang mga tao na talagang hindi tinamaan ng virus na yon. Bakit nga ba ganon? Kasi magkakaiba yung level or degree of immunity natin sa ating katawan. And again, the immune response or the immunity is in terms of innate or yung ating nonspecific. So sabi nga niya dito, we are born with this capability. And dahil naturally occurring siya sa ating katawan, very immediate ang kanyang response. So pagka nagkaroon ng pathogen sa katawan, automatic yun yung katawan mo nagre-response na to these pathogens. Pero meron din tayong tinatawag na acquired or adaptive. Ito yung nade-develop natin over time or ito yung mga idinadagdag natin sa ating katawan, such as yung ating vaccine. So sometimes hindi enough yung ating innate defenses. So kailangan nating tulungan yung ating katawan, kailangan nating dagdagan para mas maging stronger yung kanyang immune response. Okay? So let's start with the different non-specific defenses or the non-specific responses of the body to certain pathogens. So the first one, of course, is in the form of exterior barriers. Ang pinaka-effective na way to prevent sickness or illnesses or diseases is, of course, huwag mo siyang hayaang makapasok sa loob ng katawan mo. Kailangan mong mag-build ng mga pananggalang or barriers para hindi siya makapasok sa loob ng katawan. And we have natural barriers such as our skin. So ang primary function ng skin natin is to protect the inside of our body from pathogens. So sabi ko nga sa inyo, yung balat ninyo mismo, there are millions of pathogens there. Nakatira sila dyan sa balat mo kahit bagong ligo ka pa. Meron at merong mga dun sa pores, doon sa mga hair follicles na nakatago, hindi nalinisan nung naligo ka. So may mga naiiwan at continuously dumadaming mga pathogen dyan sa balat mo. Pero bakit hindi ka nagkakasakit? Kasi yung pathogen na yon, they remain outside of your body. They cannot enter your skin. So kailan tayo nagkakaroon ng problema? Pag nagkaroon ng injury or damage doon sa ating skin. So pag nagkaroon ka ng sugat, ibig sabihin meron ng opening na doon sa yung balat na pwedeng pasukan nitong mga pathogens going to the inside of your body. So yun yung nagkakaroon ng infection. So pag nakapasok na sa loob ng katawan mo yung mga pathogen, they can cause certain infections inside. Pero as long as they remain outside, hindi ka magkakaroon ng sakit or hindi ka magkakaroon ng infection. Okay, so we have to keep itong skin barrier na to na healthy at saka syempre damage-free. Okay, so pag nagkakaroon ng aksidente at nagkakaroon ng malalaking wounds or injury in our skin, yun yung isa sa mga kailangang binabantayan natin. Kailangan malinis yung sugat, kaya nga tayo gumagamit ng iodine and other forms of cleaning or antiseptic agents. Ibig sabihin ng antiseptic, pinapatay niya yung bacteria na nakapasok para kahit na may sugat, hindi siya namamaga, hindi siya magkakaroon ng infection. Paano natin malalaman pag may infection? Usually, yun yung merong nana. So pag nagkaroon na ng pus or yung nana, ibig sabihin, may napasok na pathogen at nag-cause siya ng infection doon sa wound. So kailangan natin siyang laging linisin. At the same time, our body has what we call as the natural mucous membranes. So when we say mucous membranes kasi, tatandaan natin na yung mga openings in our body such as the mouth, at saka yung nose, even yung tenga natin, and even your reproductive part, opening yan kasi may mga butas. Pero kung mapapansin niyo, lahat ng opening na yan, they are naturally moist. Meron silang sinisecrete na mga wax, for example, sa tenga ninyo, natural yung earwax na pinoproduce ng tenga. So bakit nga ba kailangan mag-produce siya ng mga tinatawag nating mucus na to? Kasi additional protection yon na kahit na may opening at makapasok yung pathogen, usually natatrap sila doon sa mucus. So hindi na sila nakakapasok dire-diretso sa loob. Kasi doon pa lang doon sa mucus na sinikrit ng tenga mo, na itrap na sila doon, hindi na sila nakamove forward. So papansinin nyo yan, usually moist yan sa ilong, yan sa tenga ninyo. Tapos yun yung nagtatrap ng mga dirt at saka ng mga pathogens para hindi sila makapasok. So even itong mga hair follicles na to sa ilong ninyo, di ba may mga buhok? Bakit nga ba? Kasi they help in trapping certain dirt and certain illnesses para hindi sila makapasok sa loob. So yan yung number one na protection na innate sa atin. Natural yan. Ipinanganak ka na merong ganyang certain protection from pathogens that can possibly enter your body and cause diseases or infections or illnesses. Okay? And other than that, okay, meron tayong mga parts of our, anong tawag dito, parts of our blood, di ba? Nung inaral natin yung circulatory system, sabi natin, when we talk about the circulatory system, ang pinaka-focus natin is the heart and the red blood cell. Pero yung red blood cell is not hindi lang yun ang meron sa ating dugo. Our blood also has what we call as yung tinatawag nating, wait lang ayan, yung tinatawag nating white blood cell. So when we talk about the blood, merong tatlong components yan. Meron tayo yung red blood cells, which we call as your erythrocytes. Okay? Meron din tayong platelets. Okay? Pero meron din tayong tinatawag na white blood cells. So these white blood cells, ito yung mga yan. At ang purpose ng white blood cells is actually in the form of immunity. So sila yung mga second line of defense ng ating katawan. So in case na hindi mag-work yung skin at nagkataong merong nakapasok na pathogen sa loob ng katawan, sino na yung susunod na lalaban dito sa mga pathogen na to? Yun yung tinatawag nating white blood cells. At meron tayong 4 na uri ng white blood cells that is categorized under the non-specific responses. So the first one is your neutrophil. Yung neutrophil natin, ito yung pinakamas kilala nating white blood cells. Sila ay umiikot sa loob ng ating katawan. They are in your blood. So they just circulate around and around your body. Sila yung parang mga tanod sa barangay ninyo na nagro-ronda every hour para mag-check kung merong pathogen na nakapasok or hindi. So kapag wala namang nakapasok, ikot lang sila ng ikot. Pero during their patrol or during their pag-iikot, if they found na in certain areas of the body, merong pathogen na nakapasok, then they are going to kill that pathogen. So yan yung tinatawag nating neutrophil. So medyo general siya, para siyang tanod na kahit anong uri ng problema, kaya niyang solusyonan. Okay? So let's continue later. Ayan. Yan yung ating neutrophil. So yung neutrophil, originally they are called as the white blood cells. And sabi nga natin, they're always going around the body. So they are actually able to migrate into the different cells or into the different tissues inside our body. At sila yung tinatawag nating first responders. Kasi nga, pag nagro-ronda sila, as long as may na-identify sila na pathogen, automatic yon, gumagawa na sila ng paraan. Okay? So, paano sila gumagawa ng paraan? We have to understand na itong mga neutrophil na to, meron silang parang radyo na kaya nilang mag-communicate with each other, na kapag itong si neutrophil letter A ay nakahanap ng isang pathogen, within seconds kaya niyang tawagin lahat ng kaibigan niya na neutrophil, si B, C, D, E, N, G, para paligiran itong pathogen na to. So yun na yung tinatawag nating chemotaxis. When we say chemotaxis kasi, pag na-identify na ng neutrophil na may pathogen, nagre-release siya ng signal para yung other neutrophils pupunta doon sa area niya para mas marami silang pwedeng lumaban doon sa pathogen na nakapasok. Okay, so yun yung tinatawag nating chemotaxis. Opposite siya ng concentration gradient. Kung natatandaan ninyo when we learned about the respiratory system, sabi natin ang respiratory system functions on the idea of concentration gradient. Ibig sabihin, ang movement niya is from an area of higher concentration to an area of lower concentration. So kung saan mas madami, papunta siya doon sa mas kukonti. Okay? Pero ang chemotaxis, hindi siya nagfa-function using the idea of concentration gradient. Ang chemotaxis kasi, kung saan siya kailangan, doon siya pupunta. So kapag may isang neutrophil na nakapag-identify na ng pathogen, this neutrophil will release signals na sasabihin na, oy, kailangan kayo dito. Kailangan ng neutrophils dito. So lahat ng neutrophils, ang movement na nila, kahit saan na sila, basta pupunta sila doon sa area kung saan sila kailangan. At ano nga ba yung areas kung saan sila kailangan? Usually, yun yung areas na merong sugat or merong injury or merong damage. So kung nasaan yung infection, kung saan nakapasok yung pathogen, nandoon sila halos. So kung meron kang na-inhale na virus na punta siya sa respiratory system mo. Ibig sabihin, yun yung area kung saan sila dapat pumunta. So ang chemotaxis nila, papunta doon sa respiratory system. Para yung nakapasok na pathogen sa loob ng respiratory system mo, hindi na sila dadami. So pagka napakonti na yung pathogen doon, tas napatay na sila completely, ibig sabihin wala nang infection. Pero pag yung bacteria nakapasok in your respiratory system at dumami sila doon, so yun na yung maaaring mag-cause ng mga sakit such as pneumonia, tuberculosis, like that. So kailangan itong mga neutrophils na to, masisipag sila na maghanap ng mga pathogens at mag-identify ng mga pathogens. Now, kapag na-identify na nila yung pathogen na yon, napaligiran na nila yung pathogen na yon, ang gagawin nila is what we call as phagocytosis. So when we say phagocytosis, ibig sabihin, para nilang kakainin yung pathogen. Papaligiran nila, tapos they will, anong tawag dito? They will release or they will secrete a certain enzyme, usually acidic yung form ng enzyme, para masira yung pathogen or mamatay yung pathogen na yon. So pag namatay na yon, ilalabas na yon ng ating katawan. So yun yung ginagawa ng mga neutrophil or what we call very commonly as your white blood cell. So para nilang pinapaligiran yung mga pathogens at unti-unti nilang tutunawin using the enzymes, usually acidic enzymes na meron dito sa mga neutrophils na ito. Okay? So that is one kind of our white blood cell. Next, we have what we call as your basophils. Your basophils are another kind of white blood cell. At sila usually yung nagpo-produce ng inflammatory reactions. So when we say inflammatory reactions kasi, ito yung mga namamaga na, usually ang kanilang response is in terms of allergens. Okay? So alam naman natin yan, yung iba sa atin may mga allergies in certain substances. So for example, yung iba pag nakakain ng peanuts, ang nangyayari is hindi sila nakakahinga kasi yung kanilang larynx dito ay namamaga. So pag namaga yung larynx, ibig sabihin lumiliit yung space kung saan pwedeng pumasok at lumabas yung gases. So pag lumiit na yung space, ibig sabihin nahihirapan ng huminga yung tao kasi maliit na yung space kung saan pwedeng pumasok yung oxygen. At the same time, nag-a-accumulate yung carbon dioxide inside the body kasi nahihirapan na rin siyang lumabas. So ang gagawin ng katawan natin is, ayan, so mag-release siya ng tinatawag nating histamines. So itong histamines na to, ito yung nagkukos ng tinatawag nating inflammation. Okay? So response yan ng ating katawan, kasama dyan yung response na pamumula. Usually, di ba, namumula yung balat or namumula yung mata pag may certain allergies. Kasi meron din siyang tinatawag na vasodilation. Ibig sabihin, ini-increase niya yung flow ng blood into that certain area. So, kaya usually yon na mumula. So, yung mga inflammatory secreting cells natin is what we call as your basophils. So, na-identify niya na merong allergen na nakapasok sa loob ng katawan natin. So, siya yung nagsisignal ng response sa katawan natin. At usually, yung response na yon is in the form of inflammation or in the form of vasodilation. Okay? So, ano ang ginagawa natin kapag kayo ay may allergy? Usually, ang umiinom kayo ng antihistamines. So, ibig sabihin, pag uminom kayo ng antihistamine, piniprevent nyo yung basophil from producing the histamines here. At pag hindi na na-produce yung histamine, ibig sabihin, nawawala yung inflammation at saka nawawala yung pamumula or yung vasodilation. So, yun yung dahilan kung bakit kayo umiinom ng antihistamine. But you have to remember that the production of histamine at saka itong inflammation and vasodilation, they are natural responses of our body to indicate na merong nakapasok na allergen. Okay? And other than that, syempre meron tayong eosinophils. Ito naman, ang kanyang target ay yung mga parasites. Kung yung neutrophils ay very general, kahit ano, pwede nilang labanan. Yung basophils ay nakakoncentrate lang sa mga allergens. Yung mga eosinophils naman ay naka-concentrate lang para sa mga parasites. So sila yung mga parasite-destroying cells. So pag may nakapasok na eggs ng parasitic worm or pagka merong nagkaroon ng fungal infection dyan, usually yung mga eosinophils ang lumalaban, nagre-release ng mga chemicals which produces response from our body. Okay? So ito yung nangyayari during an infection or an injury. So this is our skin. So sabi natin, this is your first line of defense. Now, very natural, syempre, we are moving and accidents happen na tayo ay nagkakaroon ng sugat. So in this case, nagkaroon siya ng sugat sa tuhod. So nagkaroon ng breakage or damage doon sa skin. Nagkaroon ng opening which allows the bacteria, itong mga green na to, na makapasok sa loob ng katawan. Okay? So, merong neutrophil dyan na naka-identify na, uy, may mga bacteria na nakapasok. So, ang gagawin nito ay magre-release siya ng signal calling the help of other white blood cells. So, pag na-release ng mga white blood cells na yon yung signal, lahat sila ay pupunta sa area na to. At pag nagpunta na sila sa area na to, sa kanila pinapatay through phagocytosis itong mga bacteria na nakapasok. Now, while fighting for this bacteria, syempre may mga certain reactions na nangyayari sa loob ng ating katawan, depending on the gravity of the injury. So, depende sa dami ng bacteria nakapasok or depende sa dami ng allergens or toxins na nakapasok sa loob ng katawan. Siyempre, pag mas marami, ibig sabihin, mas malaki yung response na nararamdaman ng ating katawan. Pero kapag konti lang, minsan hindi na natin siya masyadong nararamdaman. Okay, so yung mga maliliit na sugat, hindi nyo na siya masyadong ramdam. Okay, so ayan yung ating non-specific, anong tawag dito, responses. So some of them are in the form of redness. Usually to sa mga allergens. Kasi nga it is due to what we call as vasodilation. And some of them, dahil nagkakaroon ng vasodilation, ibig sabihin mas bumibilis yung circulation of the blood in our body. So nagkukos siya ng heat. Di ba sabi natin kapag isa sa function ng circulatory system is in the form of thermoregulation. So by circulating blood, na maintain niya yung temperature ng katawan. So kapag bumibilis yung circulation ng blood, mas tumataas yung body temperature. At pag mas bumibilis yung ating circulation of blood, ibig sabihin, nag-i-increase din yung tinatawag nating metabolic activity. So ano yung tinatawag nating metabolic activity? Ibig sabihin, kapag may diseases or illnesses or injury, mas madaming energy yung ginagamit ng ating katawan. So dahil mas madami yung energy na ginagamit ng ating katawan, ibig sabihin yung mga individual cells natin, mas marami yung nutrients na kailangan nila. So kailangan mas mabilis yung delivery ng red blood cell ng mga nutrients doon sa individual cells para yung mga individual cells makapag-create ng mas maraming energy na kakailanganin to fight the infection. So kung mapapansin nyo yan, kapag may infection, usually nararamdaman ninyo na parang mainit yung pakiramdam ninyo or yung iba sa inyo nagkakaroon ng lagnat. Later on, we will talk about yung fever na yan and how it helps the body fight certain infections. Okay? Other than heat, of course, yung iba swelling, namamaga, lalo na yung mga due to allergens at saka due to infections. Napapansin nyo yan, may mga sugat na namamaga kasi nagkakaroon ng infection sa loob, so nagkakaroon ng nana or yung tinatawag nating pus. Yung iba naman sa allergies, na namamaga yung mata, namamaga yung nagsiswell yung skin, kung saan nagkaroon ng histamine or allergic reactions. So ayan, swelling kasama yan. Pain, of course, nagkakaroon tayo ng certain irritations or certain feeling of pain pagka meron tayong disease or illness or sickness. Lalong-lalo na yung, for example, may nakapasok na bacteria sa loob ng tiyan. Amoeba, for example, yung pathogen, nag-cause siya ng amoebiasis. So, ang pinaka-common na symptom dyan is nagkakaroon ng sakit sa tiyan or nagkakaroon ng, ano tawag nila doon, yung cramps, stomach cramps. Okay, so nakaka-experience ng pain yung tao, which is an indication na merong nakapasok na pathogens sa loob. Okay? And in some cases of acute inflammatory response, ibig sabihin, medyo malala na yung infection, usually umaabot ng 8 to 10 days or even longer sometimes depending on the severity of the inflammation. So for example, yung pneumonia, usually yung 2 weeks before completely mawala sa katawan. Kung medyo mahina pa yung immune system mo, umaabot pa siya ng 3 or 1 month. So depende sa magiging response ng katawan mo in certain inflammation. Okay, so sabi ko nga, depending on your level of immunity. So kung medyo malakas ang immune system mo, in 7 days, 7 to 14 days, you're good to go. Pero meron talagang iba na longer than 14 days ang kailangan ng katawan nila to really fight against the infection. Okay? So you have to remember that yung mga responses na ginagawa ng katawan natin, these are what we call as your symptoms. Kaya pag nagpunta kayo sa doctor, usually ang tinatanong ng doctor sa inyo is, ano yung mga symptoms na nararamdaman mo or yung mga sintomas? So some of these symptoms are ito, meron tayong mga redness of the skin, allergic reaction, yung bahing ng bahing, may mga certain swelling, at saka yung increase in body temperature. So you have to remember that the symptoms are actually the responses na ginagawa ng katawan natin, but they are not the actual illnesses. So iba po yung lagnat sa trangkaso. Yung lagnat kasi is a symptom, it's not an illness. So halos lahat ng sakit, kasama talaga yung fever as one of the symptoms. So kung kayo ay may chickenpox, lalagnatin talaga kayo. Pero ano yung sakit? Is it the lagnat or is it the chickenpox? So syempre ang sakit is yung chickenpox. Nakapasok yung virus doon sa katawan mo. So yung viral infection na yun yung sakit. Sintomas lang yung lagnat. Okay? Kung kayo ay may trangkaso, it is caused by a flu virus. Pero yung trangkaso ang sakit, yung lagnat ay isang sintomas lamang. So it's the way of your body to fight against the infection. So how does the body do that? Pakita ko muna itong picture na to. This is what basically fever is all about. When we talk about fever, ito kasi yung lagnat. So yung katawan natin, pag meron siyang nakitang pathogen sa loob, di ba itong si neutrophil ay mag-release ng signal. At pagka marami yung nai-release na signal, ibig sabihin maraming pathogen yung nakapasok, the brain will cause what we call as vasodilation. So, mas bibilis yung magiging circulation of the blood. Tapos kasama doon is tumataas yung ating body temperature. So, paano nagiging okay yung body temperature? Yung pagtaas ng body temperature. Siyempre, the viruses cannot survive, or even bacteria, they cannot survive in very hot environments. So, pag tumaas yung temperature, di ba katulad sila Spallanzani, sila Needham, bakit nga ba nila pinakuluan yung broth? Kasi nung nag-apply sila ng init or ng heat, they are able to kill the bacteria that is inside the broth. So ganun din yung katawan mo. Pag tinaas niya yung temperature, it is increasing yung capability ng katawan mo na patayin itong mga viruses. So kung makikita nyo dito sa picture na to, namatay nga yung viruses or yung bacteria. Pero, syempre, hindi rin pwedeng sobrang taas ng ating lagnat. Kung namamatay yung mga bacteria, there is also a possibility na yung different cells and organs in the body can be damaged by overheating. So, hindi rin pwedeng sobrang taas ng lagnat ng katawan. So, for example, pag nag-reach na kayo ng 41, 42, 43 degrees, yun yung tinatawag nilang kinukumbulsyon ka na. So, hindi na rin yun healthy. Patay nga yung bacteria, but there is a risk or a possibility na even yung iyong katawan ay ma-damage. Some proteins in your body may be damaged, some cells, some organs may be damaged. Kaya pag kayo ay may lagnat, kung mapapansin ninyo, pinapainom pa rin kayo ng analgesics. Usually yung paracetamol. Kailangan pababain yung lagnat. Pag pinababa kasi yung lagnat, ibig sabihin, safer yung mga cells at organs mo sa loob ng katawan. Pero tatandaan natin na pag pinababa natin yung lagnat, we are also increasing yung possibility na kahit hindi pa namatay yung bacteria or virus, they stay inside the body. So it's actually, meron siyang advantage, pero at the same time, meron din siyang disadvantage. So siguro kung hindi siya mapatay ng init ng ating katawan, we have to depend on our immune system to discharge or patayin itong mga pathogens na nakapasok na to. Okay? So when we talk about fever, sabi natin this is a symptom that is caused by the abnormal elevation or increase of the body temperature. So ang normal temperature natin is 37 degrees. So pag tumaas na yan into 38, 39, 40, ibig sabihin may lagnat ka na or fever. At yung lagnat na yan is because it is a symptom usually for inflammatory responses. Okay? So during this time, yes, yung increase in the heat can kill pathogens in our body. So sabi nga niya dito, benefits niya, pinipigilan niya na mag-reproduce or dumami pa itong mga bacteria and viruses in our body. Pero, syempre, meron din siyang disadvantage or risk. Pag sobrang taas na siya, it can cause damage into our cells and different organs in our body. So this fever, it's a natural response of your body. Innate yan. So ipinanganak tayo na talagang alam ng katawan natin na in terms of inflammation or infection, yung lagnat na yan ay isa sa paraan para mapatay natin itong mga pathogens na yun. But sometimes, having a fever is not enough. So ayan din yung how do antihistamines work. So kapag ka kasi na-detect ng katawan mo na merong allergen na nakapasok sa loob, the eosinophils will release histamines. At yung histamine na yon ang magkukos ng inflammation at saka yung redness or swelling. Na kung ayaw mong magkaroon ng ganong response yung katawan mo, you can take antihistamines. Para itong eosinophils, hindi na siya magre-release ng histamine, so mawawala yung swelling, mawawala yung redness, at saka mawawala yung anong tawag dito? Irritation na naging result ng allergen na yon. Yun nga lang, syempre, hindi niya na kayang labanan yung allergen. So may mga natural allergens tayo such as yung mga pollen from flowers, yung dust, yan, very common na allergens yan. So, hayaan mo nang humatching ka ng humatching or bumahin ka ng bumahin, diba? Para mawala yung allergen sa loob ng katawan. Pero kung sa tingin mo sobra naman na yung response ng katawan, then yes, you can take antihistamines. Pero wag lang natin gawing habitual kasi maaaring maging immune na yung ating katawan. At the same time, syempre, part of chemical yan, so it might affect pag too much or na-overuse yung inyong kidney. So yung palaging umiinom ng gamot, usually nagkakaroon sila ng mga chronic kidney diseases. Okay? So other than the non-specific responses, meron din tayong tinatawag na specific defense or yung acquired responses in our body. So when we say acquired, ibig sabihin, hindi siya innate, pero later on in our life, na-develop siya ng katawan mo, or later on in your life, dinagdag mo siya sa loob ng katawan mo. So when it comes to specific responses, meron tayong dalawang uri ng cells. We call them as lymphocytes, and we have what we call as the B cells and what we call as the T cells. And other than that, syempre, meron tayong tinatawag na antibodies. Okay? So these B cells and these T cells are actually created in the bone marrow. So ano nga ba yung bone marrow? Ito yung nasa kulay brown na nasa loob ng buto. So kung kumakain kayo ng bulalo, yun yung masarap na kainin. So this bone marrow is the one that creates the red blood cells. Diyan din ginagawa yung white blood cells natin. At diyan din ginagawa itong mga lymphocytes. Okay? So pag itong lymphocytes na to, very general yan. And then later on, magiging specific or differentiated cell na sila. The lymphocytes will, some of the lymphocytes will stay in the bone marrow, and then some of the lymphocytes will go in the thymus. So yung thymus, this is anong tawag dito, an organ here, located here sa baba ng inyong throat, somewhere in between your liver and lungs. Meron tayong organ dyan that we call as thymus. So some of the lymphocytes will stay in the bone marrow, and some of the lymphocytes will migrate and go to the thymus. So yung mga lymphocytes na nagstay inside the bone marrow, they will mature and they will differentiate into what we call as your B cells. Tapos itong mga lymphocytes that migrated into your thymus, they will mature and they will differentiate into what we call as your T cells. So clue word, pag naiwan sa bone marrow, bone, letter B, they will differentiate into B cells. Pag nagpunta sa thymus, letter T, they will differentiate into your T cells. Okay? So ano nga ba ang function ng B cells at ano nga ba ang function ng T cells? Okay? So ito yung thymus natin. And then of course yung bone marrow sa loob ng katawan. Loob ng, anong tawag dito? Loob ng buto. So itong B cells na to, basically ang function nila is to recognize what we call as antigen. So para silang mga neutrophils, umiikot sila sa loob ng ating katawan. At ina-identify nila itong tinatawag nating antigen. Okay? So pagka may nakapasok kasi na pathogen sa loob ng katawan, itong si macrophage or other neutrophils, kapag hindi niya, for example, si neutrophil, medyo maliit lang kasi si neutrophil, pag hindi niya kayang labanan yung pathogen, hindi niya kayang patayin, ang gagawin niya, lalagyan lang niya ng label. So yun yung tinatawag nating antigen. So yung label na yon ang nagsasabi is, pathogen ito, it has to be destroyed. So itong si B cell, ang hinahanap niya is yung mga cells or pathogens na merong label or merong tinatawag na antigen. At pag nakita niya tong pathogen na to na naka-label na, yun yung tatawagin niya yung attention ni T cells. So ang gagawin ni B cell is that kukunin lang niya yung attention or magre-release lang siya ng signal para yung antigen dumami at saka itong si T cells ay magpunta doon sa lugar na yon. Okay? So siya lang yung tagatawag ng attention. Nag-iikot siya, tapos kapag nakita niya na yung pathogen, itatawag niya na kay T cells. Si T cells, sila yung, for example, ito yung antibody. Ididikit niya yan doon sa pathogen. So pag nakita ni B cell na merong nakadikit na antigen dyan sa pathogen na yan, tatawagin na niya si T cells. At itong si T cells, sila yung pupunta doon sa lugar na yon at sila yung papatay or magde-destroy nitong tinatawag nating mga pathogens. So yung B cells ay tagatawag lang ng atensyon. Yung T cells, yung actual lymphocyte na nagdi-destroy ng ating mga pathogen. So paano nila dinidestroy? The same as your neutrophil, medyo mas powerful lang sila compared sa neutrophil. So even yung mga cancer cells, kapag konti pa lang, kayang i-destroy ng T cells through what we call as your phagocytosis. So ganun din, papaligiran nila, nagre-release sila ng acidic enzyme, at yung enzyme na yon ang magdi-destroy doon sa anong tawag dito? Doon sa mga pathogen na yun. Okay? So this is our immune response. So for example, this is your virus. Okay? So pagpasok ng katawan ng virus na yan, lalagyan siya ng tinatawag nating antigen or yung marker or yung label niya na nagsasabing it has to be destroyed. So pag dumami na siya sa loob ng katawan at na-detect na siya ng ating B cells, the B cells will now call the attention of your T cells at itong T cells na to ang papatay nitong mga pathogen na yon. Now you have to remember that the B cells, napakataas ng kanilang memory. So some of the B cells are actually converted into memory cells. So sila yung forever lang na umiikot sa katawan mo at natatandaan nila kung ano yung itsura ng virus na nag-cause ng sakit na yon. Natatandaan nila yung itsura ng bacteria na nag-cause ng sakit na yon. At pag namukaan ka nila, automatic yon, tatawagin na niya lahat ng T cells. Kaya yung sinasabi nila na kapag ang isang bata masyadong malinis or hindi siya masyadong exposed in bacteria or viruses, yung sinasabi nilang mahina yung kanyang immune system. Bakit? Kasi konti yung kanyang memory cells. Wala siyang masyadong kilalang bacteria, wala siyang masyadong kilalang viruses kasi wala pang kumbaga sa history ng katawan na yon, wala pang nakapasok na bacteria or virus doon. So, pag nakapasok na yung bacteria, dahil hindi siya kilala ng memory cell, hindi siya ganun kabilis mag-create ng response. Whereas yung mga bata na naka-experience na nitong sakit na to, natandaan na ng katawan kung ano yung itsura ng bacteria na nag-cause ng sakit na yon. So next time, pag pumasok ulit yung bacteriang yon, mas mabilis na yung response ng katawan kasi kilalang-kilala na siya ng mga tinatawag nating memory cells. Okay? So yan yung ating specific or acquired na responses. So ayan yung example. Itong kulay red, ito yung antigen. Nakadikit siya doon sa virus. So nung nakita siya nung B cell, tinawag si T cell. Si T cell na yung pumatay doon sa pathogen. Okay? So this idea of antigens and antibodies and the production of memory cells is actually related to what we call as your vaccines. So isa sa mga pinaka-controversial na topic nowadays is it safe for you to take the vaccine or not? Kasi yung iba, ayaw nilang magpa-vaccine, pero gusto nilang lumabas ng bahay nila, gusto nilang bumalik sa trabaho, gusto nilang bumalik sa old normal. Pero yung iba naman, okay lang for them to take vaccines. So let's try to understand what's the debate all about before we make our decisions on whether we will be vaccinated or not. So you have to understand that there are actually different types of vaccines. Nung unang panahon, walang ganito karaming vaccine. Pero ngayon, because of the technology, napakaraming uri na ng vaccine. Noong unang panahon, ang pinaka-common is what we call as the attenuated vaccine or the live attenuated vaccines. Ito yung, personally, ito yung mga parts na sa tingin ko, bakit hesitant yung mga tao. Ang idea kasi ng mga tao is kapag vaccine, ibig sabihin, kung yung COVID vaccine, ang gagawin nila is maglalagay ka ng COVID virus sa loob ng katawan mo. So yun yung nasa loob ng vaccine, actual na COVID virus. Para yung katawan mo makikilala kung ano yung itsura ng COVID virus. At pag nakapasok ulit siya sa katawan, yung memory cell, mas mabilis na yung reaction kasi alam niya na okay, ganito ang itsura ng COVID virus. So yung ibang tao natatakot kasi syempre ayaw nilang, di ba iniwas-iwasan nga nating makapasok yung COVID. Bakit ngayon magpapavaccine ka? Lalagyan ng totoong live COVID virus yung katawan mo. Yun yung tinatawag nating live attenuated vaccine. So meron talagang mga vaccines na ang laman niya sa loob ay viruses or bacteria na buhay. Okay? So isa sa example ng attenuated vaccines is yung ginagamit nila for chickenpox at saka as far as I know yung ginagamit sa tuberculosis. attenuated vaccine yun. Ibig sabihin, sa loob nun, merong buhay na virus for tuberculosis at merong buhay na virus for chickenpox. So, dangerous ba siya kasi nagpasok ka ng virus or bacteria sa loob ng katawan mo? The answer is no. Kasi yung ipinasok naman na virus or bacteria sa loob ng katawan mo is napakaliit lang. So, kaya siyang isuppress or kaya siyang labanan ng katawan mo. So, very common yon kapag vaccination for chickenpox at tuberculosis, may fever after, kasi syempre may nakapasok na pathogen. So, kailangan labanan ng katawan. So, pagka nagkaroon ng fever, namatay na yung bacteria, hindi ka na magkakaroon ng sakit. Ang kailangan mo lang naman is i-expose mo yung sarili mo para makilala siya ng memory cells mo. Kasi pag nakilala na siya ng memory cells mo, mas mabilis na yung response next time around na ma-expose ka sa tuberculosis or chickenpox. Okay? So yan yung live attenuated vaccine. Pero tatandaan natin na hindi lahat ng vaccine ay live attenuated. Actually, when it comes to COVID ngayon, wala pang available na vaccine that is actually live attenuated. So kung ang ikinakatakot nyo is magpapasok ng COVID virus sa loob ng katawan nyo, hindi po. Kasi yung Sinovac, yung Sinopharm, yung AstraZeneca, hindi sila lahat live attenuated vaccines. Ibang uri sila ng vaccine. Okay? Yung Sinovac and yung Sinopharm, sila yung tinatawag na inactivated vaccine. Ibig sabihin, merong virus sa loob ng vaccine. Pero yung virus na yon ay patay na. Ipinasok siya sa katawan mo for the purpose na makilala lang siya ng memory cells mo. Pero hindi ka niya pwedeng mag-develop ng COVID kasi patay na yung virus na papasok sa loob ng katawan mo. So yan yung tinatawag nating Sinovac at saka yung Sinopharm. Lahat ng galing sa China are categorized under inactivated vaccine. Kasi syempre sila yung unang nagkaroon ng COVID cases. So siguro marami silang nakuhang COVID virus na patay na. So yun yung ginamit nila in creating the vaccine. Even yung polio vaccine is actually in the form of inactivated vaccine. So pag in-inject siya sa katawan ninyo, makikilala siya ng memory cells, pero yung possibility na magkaroon ka ng sakit because of this vaccine is napakababa or very zero. Kasi tatandaan natin, patay naman na yung virus. So kahit makapasok siya sa loob ng katawan mo, it can no longer cause yung illness or yung sakit. Okay? So yan yon. Other than the inactivated vaccine, we have what we call as ito yung isa sa pinaka popular, yung tinatawag nating RNA vaccine. Yung RNA vaccine kasi, ang kinuha lang nila yung isang part ng virus. So in the case of COVID, ang kinuha nila is itong mga spikes niya sa loob. So kinuha nila yung DNA sequence or yung RNA sequence nitong spike na to. At yun yung nireplicate nila, pinadami nila doon sa vaccine. So pag pinasok siya sa loob ng katawan mo, ang nadidetect niya is yung spikes nitong virus na to. So kahit anong merong spike, lalo na yung specific na sequence, RNA sequence na to, ang magiging reaction ng katawan mo is, uy, may virus na nakapasok. Kasi na-detect ng memory cells mo yung sequence, yung genetic sequence ng mga spikes nitong, nitong virus na to. So itong RNA vaccine na to, ito yung isa sa mga pinakaunang na-develop at ito yung isa sa mga pinakamatataas ang efficacy or efficiency rate, such as yung Pfizer, BioNTech, at saka yung Moderna. Pfizer, BioNTech, and Moderna are US, American pharmaceutical companies. So sila yung isa sa pinakaunang nag-produce ng vaccine at sila yung isa sa mga pinaka-effective na vaccine. Kasi nga, dahil yung spike ang dinedetect niya, so kahit mag-evolve yung virus, yun yung sinasabi nilang bagong strain, coming from the UK na mas malala yung kanyang symptoms manifestation. Kahit na mag-evolve pa siya at mag-iba pa yung strain niya, as long as meron siyang spike, nadedetect at nadedetect siya ng katawan natin. Kasi ang kinuha nila na pagkakakilanlan is itong spikes ng COVID. Okay? So yan yung Pfizer and Moderna. Okay? So effective ba siya sa katawan? Yes po. Dangerous pa siya? No. Kasi ang ipinasok mo lang sa katawan mo is yung sequence nitong spikes. So hindi talaga siya magde-develop into another virus. Kasi yung ipinasok lang sa loob is yung isang component lang nitong tinatawag nating virus. So iba't ibang uri po yung vaccines natin. And in the end, ang ginagawa lang talaga nila is that they are exposing your body to this certain virus or to this certain part of the virus para makilala siya ng katawan mo. Kasi pag kilala na siya ng katawan mo, ibig sabihin, mas mabilis na yung immune response ng katawan mo. Pag nakapasok na siya, hindi niya na pag-iisipan na masama ba to or hindi, pathogen ba to or hindi. Automatic kilala niya na COVID to. So ganito yung kailangang response na gawin ng ating katawan. Okay? So, scientifically, these vaccines are safe. So hindi siya, it can never lead to you acquiring COVID or to you being positive with COVID nang dahil lang sa kayo ay nagpa-vaccine. Kung kayo ay magkaroon ng fever after vaccination, then that is a normal response of the body. Pero yung fever na yon, like I said, it's not an illness, hindi siya sakit. At hindi ganun katagal yung magiging response ng katawan mo. So yung lagnat na yun, pang sandalian lang yon. And commonly na i-experience yan ng mga babies. Di ba? Pag may mga baby na pina-vaccine na. For example, yung pamangkin ko, 4 months pa lang, nakailang vaccine na siya, parang 4 or 5. And common yun na after vaccination, kinagabihan, usually medyo mainit siya or sometimes may lagnat, pero common yun. Common response ng katawan yun. But it doesn't have to be deadly. Hindi talaga siya deadly. Even yung dengue siya na sinasabi nilang maraming namatay. Actually, if we're going to talk about statistics, hindi talaga siya marami. Sa dinami-dami ng vaccinated with dengue siya, konti lang yung may mga reactions na nangyari. At yung mga reactions na nangyari na yun, hindi nila ma-identify kung talagang purely because of the vaccine siya or because of other factors. So yun yung kailangan i-identify. So yung general fear about vaccines, I think, is because of the lack of awareness or the lack of knowledge of how vaccines work. Because when you understand how they work, you will understand na, hindi naman pala siya ganon ka-dangerous. And you have to understand na lahat tayo, ever since we are babies, we are already vaccinated. And hindi naman tayo namatay. So it's just the same when it comes to the COVID vaccine. So kung sasabihin ninyo ano yung pinaka-effective, all of them are effective. Pero may certain level of efficacy. Talagang mas ma-effective ang Pfizer, BioNTech at saka Moderna. Pero kasi ang problem when it comes to Pfizer, BioNTech is yung storage facility. Hindi kayang bilhin ng Pilipinas, wala tayong pera. At the same time, hindi kaya ng Pilipinas na mag-create ng storage facility for Pfizer, BioNTech. Kasi ang storage requirement ng Pfizer, BioNTech is that kailangan negative 60 degrees yung lamig ng storage facility para effective yung vaccine. So wala na nga tayong perang pambili, gagastos pa tayo sa storage. So ang pagkakaintindi kong pinili ng government is syempre yung mas madali nating i-maintain or mas madali nating i-store, which is in the terms of Sinovac or Sinopharm. If meron man silang naging kurakot in acquiring for these vaccines, then hopefully wala at sana namili talaga sila ng based on what will be good for the Filipino people. Pero yung idea na wag magpa-vaccine kasi mamamatay ka, I think it's a very uninformed decision yon. So before you decide, read about the different vaccines. Kung gusto niyo specifically, read about Sinovac, read about Sinopharm before kayo magpa-vaccine. Read about Moderna, di ba? Before tayo magsabi na, ayoko kasi mamamatay ako, so kayo na lang. So yun nga yung sinasabi nila na any form of protection, whether it is only 60% effective or 70% effective, any form of protection is better than nothing. So, kung ang Sinovac ay 70% effective, 70% is better than 0%. Kasi pag wala kang vaccine, then automatic, you don't have the yung bilis ng response at saka you are exposing yourself to additional complications na pwede namang maiwasan. Okay, so yung mga chickenpox na yan, naiiwasan natin yan because we are vaccinated against chickenpox. At yung chickenpox na yan ay attenuated vaccine pa. So how much more yung ino-offer ngayon, hindi naman siya attenuated vaccine. Inactivated siya o kaya RNA vaccine. So I think safer siya compared to the attenuated vaccines. Okay? And the reason why we have to be vaccinated is because we are trying to reach what we call as herd immunity. Patapos na ako saglit na lang. So itong herd immunity na to, pag na-achieve na natin to sa Pilipinas, that's when we can say that we can go back to the old normal. So kung gusto nyo nang mag-face-to-face at kung gusto nyo nang pumunta sa kung saan-saan nang walang restrictions or limitations, we have to achieve what we call as herd immunity. Ano nga ba yung herd immunity? Ibig sabihin ng herd immunity, at least 70% of the population is already vaccinated. Bakit kailangan nating ma-reach yun? Kasi kapag walang vaccine, ito yung normal na situation. Lahat ng kulay blue na yan ay hindi vaccinated. They are not immunized and they are healthy. Meron tayong dalawa na may sakit ng COVID. So ibig sabihin, lahat ng kulay blue na yan pwedeng mahawaan nitong dadalawang may sakit. So after some time, mas marami na yung may sakit doon sa population compared doon sa walang sakit. So yan yung nangyari sa atin last year, kaya tayo nag-lockdown. Kasi lahat tayo are pwedeng magkasakit dahil lahat tayo ay walang immunization against COVID. Let's compare it into a population na merong onte. So meron siyang 2, 4, 6 na taong merong vaccine. Mas marami sa population ang walang vaccine. Dadalawa yung may sakit. Itong lahat ng kulay blue na to, mas marami pa rin yung possible na magkasakit. So in the end, marami pa rin yung may sakit. At konti pa lang din yung merong immunization. So pag sinabi nating herd immunity, ibig sabihin, majority of the population are immunized. So kahit na ma-expose na sila doon sa taong may sakit, in the end, hindi naman sila magkakasakit kasi meron na silang protection, may immunization na sila. So konti pa rin yung number of sick cases. So kung dalawa dito, dalawa pa rin dito. Kasi ang pwede lang nilang hawaan dyan is itong aapat na kulay blue. Napaka-konti niyan. And what are the chances na yung konting apat na yan, sila pa yung ma-expose doon sa may sakit. So kapag ka nadikit siya dyan sa may kulay yellow, wala na siyang pakialam kasi meron na siyang immunization against the pathogen. So yan yung hinihintay nating ma-reach ng Pilipinas. Yan din yung hinihintay ng ibang bansa na ma-reach nila. Yung tinatawag natin na herd immunity. Ibig sabihin, marami na yung people within the place na immunized or may vaccinated against COVID. So even US, nag-start sila ng somewhere sometime November, nag-start na sila ng rollout ng vaccine. Hanggang ngayon, hindi pa nila nare-reach yung herd immunity. So hanggang ngayon, hindi pa rin sila nag-lift ng mga restrictions. Even UK, nag-start sila ng rollout ng vaccine ng December. Hanggang ngayon, hindi pa nila nare-reach yung herd immunity. Tayo ngayon sa Pilipinas, kaka-start pa lang natin ng March, ng tinatawag nating rollout ng vaccine. So, syempre, it's going to take more time for our country to reach yung certain level of herd immunity. So, if we really want to reach yung herd immunity na yan, at kung talagang gusto na nating bumalik doon sa tinatawag nating old normal, then we have to vaccinate ourselves. There is no other option than to vaccinate ourselves. At hindi lang naman COVID ang may vaccines. Marami ng diseases or illnesses may available na vaccination. So any form of protection is always better than nothing. So no matter how low yung efficacy niyan, that is still better than nothing.